There are normally 3 vital signs that you will take for your dental patient. The first thing that you want to do is prepare all of your equipment that you're going to be using. I'd like to go through each of these with you at this point. The sphygmomanometer is actually the blood pressure cuff. This particular type of sphygmomanometer is flexible. It can be attached to different size cuffs. This one being a child size cuff. It can be attached to the port on this side. It also has a large adult cuff and a small adult cuff. To attach the meter to the cuff, you simply take it and press it into the port, and it snaps into place. The other type of cuff that we have, the meter is actually attached to the cuff, so it can't be moved. The other piece of equipment that you will need is your stethoscope. You want to make sure that the angle of the ears are pointed in so that they fit into your ears comfortably. The other type of blood pressure cuff is the wrist cuff. This particular type of sphygmomanometer rests on the patient's wrist. It is tightened, and then there is an on and off button that is pressed. During this type of blood pressure, you want to have the patient rest their arm on the opposite shoulder and make sure that the legs are uncrossed. The first thing that we're going to do for the patient is to take the pulse. There are 3 different areas that you can take the pulse. One is the radial, which is along the thumb and down the side of the wrist. To take this pulse, you want to use your index finger and the middle finger together and place it right along the edge of the thumb. Never use your thumb to take the pulse because you actually have a pulse in your own thumb. So always use your index and middle finger. The other place will be the brachial. And this area, the brachial artery comes down here, and normally you will slide just to the side and feel the brachial pulse in this area. The other area is the carotid pulse, which is located on the side of the neck. This is the area during CPR where you take your pulse, the carotid. The first vital that you want to take for your patient is the pulse. You need to determine the pulse rate in order to know how far you need to pump up your sphygmomanometer. Have the patient just gently rest their arm on the chair, and it's best to have a second hand either on your watch or someplace in the room that you can watch. What we want to do is hold our fingers on the pulse for at least 30 seconds. It's important to do a 30-second pulse so that you can catch any irregularities in the pulse rate. Once you've completed the pulse, you will go directly into taking respirations. To take respirations, you never want to tell the patient that you're doing that, simply because they will start altering their breathing. So once you've completed taking the pulse for 30 seconds, stay in position as though you're still taking the pulse and view the patient as they're breathing. Never stare at the patient's chest or at the patient. Try and view this from a peripheral vision. Also, the respirations need to be taken for at least 30 seconds so that you can see any irregularities and rhythms in the breathing as well. Once you've completed taking the pulse and respirations, you will multiply both of those numbers by 2 to get a 1-minute reading. This is what you will record in the patient's chart. Once you've recorded the pulse and the respirations in the chart, you will then calculate the number for the sphygmomanometer. What you want to do is take your 1-minute pulse reading and add 40 to 60 millimeters of mercury to that number. The pulse rate that we have for Rebecca is 68. So we're going to add 40 to that, giving us 108. And that will be the number that we will pump or cuff up to when we take the blood pressure. We're going to be using the small adult cuff, and that's judged by the size of the patient's arm. There is a marker on the cuff that tells you where the cuff needs to be placed as in relation to the artery of the arm. One thing that you want to make sure of is that the sleeve of the patient can either be pushed up, or if they have a long jacket, that they need to remove at least one side so that you can get to the arm easily. If it's a thin shirt, a lot of times you can take the blood pressure over the shirt itself. When we place the cuff, we want the patient's arm extended out, and we want to place it down to our side. Never place the patient's hand in your armpit or let their hand fall into your lap. You always want to have it guided right at your elbow. Almost the palm of their hand is at your elbow. You will then align the cuff with the artery of the arm, approximately an inch above the antecubital area. And you want to make sure that the cuff is nice and straight. Always make sure that the air has been expelled from the cuff before placing it on the arm. The sphygmomanometer has a bulb on this end where you can tighten and loosen. To pump the cuff up, you want to make sure that this valve is closed. Turning it to your right will close the valve. Once this is in place, the patient can rest their arm. Then you want to take your stethoscope and place it in the antecubical area, making sure that you have your stethoscope correctly in the ears. Place the stethoscope directly over the brachial artery. With your right hand, or your dominant hand, you want to pump the cuff to the 108 reading that we got earlier. Once you have that reading, you want to release the valve slowly, paying attention to the sounds that you hear. The first beat that you get will be your systolic, which is the top number of the blood pressure. You want to continue to release this slowly until you no longer hear any sounds at all. As you hear the last sound, note the number on the gauge, and that will be your diastolic number. You want to slowly release the air until you are completely to zero. If you hear the last beat at 60, you never want to just go ahead and open the valve and release the air quickly. Remain at a slow pace until it reaches zero. Once you have your two numbers, you can then remove your stethoscope and note the number in the chart.